Let me ask you something uncomfortable. You are doing the work. You are watching what you eat. You are taking your medication. Maybe you are even exercising, and your A1C is still high. Or it keeps going up. Or it is just stuck, like someone hit pause on your progress, and nobody can tell you why. And every time you go to your doctor, it's the same conversation. Adjust the dose. Cut more carbs. Come back in 3 months. But nobody, not your doctor, not the specialist, not anyone, has ever tested the one hormone that could be silently driving your blood sugar up from the inside. Every single morning, before you eat a single thing. I am going to tell you what that hormone is. I am going to show you exactly what it is doing to your body, and I am going to give you a specific test you can ask for at your next appointment. A test that most doctors have never once ordered for a diabetic patient in their career. And I want you to stay until the end, because the last thing I am going to tell you today, that one is the thing that stops people cold. I have had patients sit across from me and just stare when they hear this, so stay with me. Now, before anything, let's talk about your A1C for a second. Everyone treats the A1C like it is the final verdict, the judge, the jury, your 3-month average, one clean number, and we build your entire treatment plan around it. And I get it, it is a useful number. But here's the problem with only looking at the A1C. It tells you your blood sugar is high. It does not tell you why. It is like your smoke alarm going off, and instead of looking for the fire, your doctor just keeps pressing the reset button. So when blood sugar is elevated, we go to the same 3 suspects every single time. What you ate, your medications, how much you are moving. And those things matter, I am not dismissing them. But there is a 4th player, a behind-the-scenes operator that most people with diabetes have never heard about in the context of their blood sugar. And this player is telling your liver to dump glucose into your bloodstream even when you have not eaten anything. It is telling your muscles to stop absorbing sugar. It is making your pancreas work harder and produce less. And it does all of this completely silently. So what is it? Cortisol. Now before you say, yeah, stress hormone, I know about that, hold on. Because what most people know about cortisol is maybe 10% of what is actually happening here. Yes, your adrenal glands produce cortisol when you are stressed. It is a survival hormone. When danger appears, cortisol floods your system. Your liver releases stored sugar for fast energy, and your body is ready to run. That is a brilliant system. The problem is, your body cannot tell the difference between being chased by something and being chased by a deadline. Between a physical threat and 3 bad nights of sleep in a row. Between real danger and the low-grade, constant modern life stress that most of us with chronic illness are swimming in every single day. So for millions of people with diabetes, cortisol is not spiking occasionally. It is chronically elevated, quietly, persistently. And the effect on your blood sugar is enormous. Here are the actual numbers. The Jackson Heart Study, a large, rigorous research study, found this. In people with type 2 diabetes, a doubling of morning cortisol was associated with a 23.6 milligram per deciliter increase in fasting glucose, and a 0.6% higher A1C. Sit with that for a second. 0.6% is clinically significant. That is the difference between your doctor saying your diabetes is controlled versus uncontrolled, from cortisol alone, before you have touched a piece of food. Now I need to tell you about something specific, something called subclinical hypercortisolism. And I want you to remember that phrase, because this is where it gets really important, and I will explain exactly what it is in a moment. But first, you need to understand the mechanism, because once you understand how cortisol actually attacks your blood sugar, the fix becomes obvious. So let me show you how this works. Cortisol hits your blood sugar from 3 directions at the same time. First direction, your liver. Cortisol tells your liver to manufacture glucose, even when your body does not need it. This process is called gluconeogenesis. It is why your fasting blood sugar is high in the morning, even when you ate nothing after 7 at night. Your liver has been working overnight. Cortisol was giving the orders. That is where your mysterious morning spike is coming from. Not what you ate, your liver. Second direction, your muscles. Your muscles are the primary place your body stores and burns blood sugar. Cortisol makes your muscle cells resistant to insulin. When that happens, glucose cannot get in. It has nowhere to go. It stays in your bloodstream. This is insulin resistance happening at the hormonal level. not just because of diet, not just because of weight, at the hormonal level. Third direction, your pancreas. Chronically elevated cortisol reduces the responsiveness of your beta cells. Those are the cells that produce insulin. So you are not just resistant to insulin, you are also making less of it. Your liver is dumping glucose, your muscles are refusing it, and your pancreas is struggling to keep up. And you are sitting there wondering why your blood sugar keeps going in the wrong direction, despite doing everything right. Now, I promised you a number, and this is the one that I cannot stop thinking about. The Catalyst study, the largest prospective trial of its kind, screened over 1,000 patients with difficult-to-control diabetes, people whose A1C was still high despite being on multiple medications. They ran one specific test on every single patient, and what they found was this. Almost 1 in 4 of those patients had elevated cortisol, 24%. 1 in 4 people with diabetes that is not responding to treatment, cortisol was a significant hidden factor. And for patients who were also on 3 or more blood pressure medications, it was closer to 1 in 3, and none of those patients had ever been screened for it. Now, this is not full Cushing's syndrome. Cushing's disease is rare and dramatic. You would know. What this is called is subclinical hypercortisolism, hidden hypercortisolism. Cortisol excess without the classic symptoms. It does not look like anything in particular. It just looks like diabetes that will not cooperate. I have been doing this for years, and the standard diabetes workup, hemoglobin A1C, fasting glucose, kidney function, cholesterol, cortisol is not in it. It has never been in it. And yet here is research showing that 1 in 4 patients with difficult-to-control diabetes has a cortisol problem. That is not a rare case. That is a massive blind spot sitting right in the middle of standard diabetes care. So how do you find out if this is you? There is a simple test. Almost nobody gets ordered it. It costs almost nothing. It requires 1 blood draw, and I'm going to tell you exactly what to ask for in a moment. But first, I need you to hear this part, because there is something specific that is making cortisol dramatically worse for people with diabetes in particular, and there is a good chance you are doing it every single day without knowing it is the thing destroying your blood sugar overnight. So what is driving your cortisol up? Number 1 is sleep deprivation, and this one creates a loop that is almost impossible to escape once you are inside it. Poor sleep raises cortisol. Elevated cortisol raises blood sugar. High blood sugar disrupts your sleep. You wake up tired, you are stressed, your fasting numbers are up, and the whole thing starts over again tomorrow night. Research shows that up to 62% of people with blood sugar problems also experience poor sleep quality. That is not a coincidence. It is the same system feeding itself. Number 2 is blood sugar crashes. This one surprises people. When your glucose drops rapidly, even a mild hypoglycemic episode in the middle of the night, your body releases cortisol as an emergency response. That cortisol then raises your blood sugar. You wake up high, and you have no idea why, because you ate nothing. That is cortisol doing its job at the worst possible moment. Number 3 is the anxiety of managing diabetes itself. The constant checking, the worry, the second-guessing every meal. That psychological load raises cortisol. The stress of having the disease makes the disease worse. Your body is not your enemy here. It is just doing exactly what it was built to do, in a situation it was not built for. Now here's what you actually do about it. Step 1. Get the right test. Ask your doctor for a 1 milligram overnight dexamethasone suppression test. This is the test the Catalyst study used. You take a small pill at 11 at night. Your cortisol is measured at 8 the next morning. If your cortisol is not suppressed below 1.8 micrograms per deciliter, that is a flag that needs further investigation. Simple, cheap, almost never ordered for diabetic patients. Ask for it by name. Step 2. Cut caffeine at noon. I know this one is painful, but caffeine consumed after midday delays your natural evening cortisol decline. That keeps your cortisol elevated into the night, which disrupts sleep, which raises your morning blood sugar. This one change produces measurable improvement in sleep quality within days for most people, faster than almost anything else on this list. Step 3. Protein at breakfast. 30 grams minimum. Not cereal, not toast, not a banana. Every time your blood sugar crashes in the first few hours of the morning, your body dumps cortisol. Starting your day with protein stabilizes glucose early, and cuts one of the biggest cortisol triggers of the entire day. Protein at breakfast is cortisol management, not just blood sugar management. Step 4. Walk. Do not sprint. High-intensity exercise spikes cortisol acutely. If your cortisol is already chronically elevated, HIIT can make the problem worse, not better. A 30 to 40-minute brisk walk, zone 2, where you can still hold a conversation, lowers cortisol over time without the acute spike. This is a big one that almost nobody gets told. Step 5. And this one has clinical evidence behind it, not just wellness blog enthusiasm. Ashwagandha. Randomized controlled trials show a 23 to 30% reduction in cortisol over 60 days at 500 to 600 milligrams per day. That is a meaningful effect size. That is one of the most evidence-backed supplement interventions in this space. Always discuss with your doctor first, especially if you are on thyroid medications. But the data is there. And the foundation underneath all of this: sleep. Fix the sleep and you start unwinding the entire loop. Consistent bedtime, dark and cool room, no screens for 30 minutes before bed, no caffeine after noon. These are not exciting answers, but they are the answers that actually work. So here is what I want you to take from this. Your A1C is not just about what you eat. It is not just about your medication. There is a hormonal layer underneath all of this that the standard workup completely misses. And for at least 1 in 4 people with diabetes that will not cooperate, cortisol has been the missing piece this entire time. Ask for the dexamethasone suppression test. Have that conversation with your doctor. And if someone tells you your diabetes is just difficult to manage, push back. Because sometimes it is not the diabetes. It is the cortisol driving the diabetes. Now, I did not get to everything today, on purpose, because cortisol is one layer of this. And there is a second hormone, one that affects women almost exclusively, that does something even more destabilizing to blood sugar than cortisol does. And unlike cortisol, it does not respond to stress. It changes on its own schedule, every month, and then it changes permanently in your 40s and 50s. And the number of women with diabetes who have watched their A1C get suddenly, inexplicably harder to control, for no obvious reason, with no dietary change, with no change in their medication, because nobody ever connected it to this hormone. That number is staggering to me. That is the next video. If your blood sugar has felt unpredictable, if it stopped following the rules, if it got harder to manage as you got older and nobody could explain why, that video is for you specifically. Subscribe so you do not miss it. And if you know someone who is fighting their numbers and cannot figure out why, send this to them right now. The answer might be a test they have never had.